historically, when we talk about Appalachia, we're talking about a system, a culture that hasn't necessarily been treated well by outsiders. And so when, quote unquote, government agencies or well-meaning healthcare providers come into the area, there might be some pushback and some distrust and mistrust, which we have found repeatedly in our own research. So that's where I would start.
One of the things we face in coming from medical research and practitioners is trying to inform people about how to, and in particular women, how to care for the children, how to care for the elderly in their families. But there's a great deal of emphasis on information.
People become very overwhelmed with how siloed healthcare has become. You have to go to this specialist, and then you have to talk to this navigator, and then you have to get a referral from this person. And so it becomes so overwhelming that folks often will just resign to not do anything. And I think that's something that the system has to consider and work harder at doing better at.
Another thing that's lacking is referral centers for secondary or tertiary hospital services. You know, they're simply not there. There's also very few specialty physicians, you know, because they're attracted to larger communities. And so all of that has an impact on access to health care for people.
I don't think that you could approach anyone in Appalachia, ask them about the substance abuse problem, and they would say, what are you talking about? I think we've reached the tipping point at which everyone knows that that's a public health issue facing our families. And now I would go as far as to say we've reached the point at which most decision makers are ready to do something about it, whether it's through employee assistance programming or supporting the research and program development we do here at ETSU.
So I've had a lot of interviews with folks with Medicaid who've talked about not being able to get an appointment or having to wait months because a provider will only have 4 slots a week for a Medicaid appointment, and you just simply can't get in because of your means of payment. You take a child to a pediatrician and you're on Medicaid to get their vaccinations. And there are 2 stacks of the same vaccine. One is paid for with state Medicaid money, and one is paid for by private insurance. And if you have the wrong means of payment for the stack that's out, they're out of that day, your child can't get the vaccine even though they have plenty in there.